Hi, good afternoon. I'm Dr. Leslie Wakefield. I'm a pelvic floor physical therapist, and this is Lunchtime Live. Today, the question was a really good one. It was from a patient with vaginismus who was working towards fertility goals, and the question was, can I have a vaginal delivery if I have vaginismus? And I like the question a lot because it is really looking ahead to the future with the goal of fertility in mind and understanding that she's going to need to make those choices as she gets there. There's some anxiety, not just around can I even get pregnant, but then the question is, can I even deliver the baby? Do I need a C-section? That piles on the anxiety. And I would love to have that conversation so that you can sort of tick that off your list. Like there is a plan for that. That is manageable. If that's what you want, we can make sure that happens to the best of our ability. So let me talk in general about what might cause issues during vaginal delivery and how that could be applicable specifically in the case of someone who has vaginismus. So any person could experience a reflexive tightening of the pelvic floor in delivery, which might impede the baby's ability to descend without maybe damaging the pelvic floor. If she is feeling anxiety when she gets that sensation of stretch. Or if she tends to run tight, so that's called high tone or tight pelvic floor, hypertonic pelvic floor, tense pelvic floor, which can happen in a lot of situations, not just with vaginismus. So either the pelvic floor itself is restricted by scar tissue, fascial restrictions, trigger points, or tightness that's pre-existing, or there's a reflexive tightening due to anxiety or tension in the body. That can happen to anyone during labor, if they fall into those categories, not just a person with vaginismus. But it's a very pertinent question for someone with vaginismus because in that particular diagnosis, a lot of times you already have both. You already have an element of tense pelvic floor or fascial restrictions or trigger points that have built up over time because of the vaginismus. And you also have anxiety around vaginal penetration or touch or sensations of stretch and a reactive closing of the pelvic floor. So you end up with both of those things potentially in the case of vaginismus. And if you are going to go into labor and you would like to deliver vaginally, what are some things that you could do to prepare yourself and to maybe compensate for that? So let's talk about my number 1 and number 2 recommendation. Again, this is actually for any woman who's going to deliver vaginally and is concerned about this, but especially in the case of vaginismus. My number 1 recommendation is do birth education and labor delivery prep. There's lots of online education courses. There's a lot of self-paced, self-taught. There's just Googling. I really believe in working with somebody in person if possible. There is something very calming about being with someone who is calm when it comes to that discussion. But educate yourself on the phases of labor, on what happens at each phase, on what positions you might be able to move into, on if you want to have a hospital delivery or a birth center delivery, or what options do you have as far as pain management. Educate yourself so that you feel like you're more in control of the situation. I have heard some people say, listen, the more I know, the more anxious I get. So if you fall into that category, sure, cross this one off your list. That one's not for you. But for the most part, for a person with vaginismus, we already know there's pre-existing issues and you're already worried about it. So go and get a really thorough education so that you understand what's that process going to look like, what's it going to feel like, who's going to be in the room with you, what options do you have. And that leads me to my number 2 recommendation, which is to get a doula. A doula she's your partner in crime while you're delivering. She is your support person. And most doulas, many doulas, have their own birth prep courses that they offer. And you can pay them not just to be present for the delivery, but also to do some of these educational courses. There's things like, there's so many, I'm just gonna say the one that comes to the top of my head. There's something called hypnobirthing, where you do these very particular, breathing and meditation techniques to manage discomfort and to put yourself into a better mental state. Depending on the birth prep that you want to do, you can pick your doula based on that. Or if you find a person that you really resonate with, then that doula can guide you into what birth prep to do. But the doula is really valuable because even if you have a dedicated partner, like your sexual partner, the father or mother of your child, they're with you, it's putting a lot on them to be responsible for your mental comfort, your physical comfort, advocating for you, knowing just where to push and just where to massage and what essential oils might help you, and to happen to have in their back pocket this particular tool or that particular sash to do this kind of movement. There are people who are professionally trained to support you during your delivery. It's not the OB. The OB is there to catch the baby and to guide you through that process safely, to make sure that you're safe and the baby's safe. Same for the midwife. That's their job. Make sure you're safe and the baby's safe, and to perform any interventions necessary. But who is there to support you and help you feel calm, and who knows your history and who understands your diagnosis and you've built a rapport with them? That's your doula. It is your support person. And I highly can't stress enough that I think that's super valuable for a person with vaginismus, to have a doula with them that they feel connected to, and even better if that doula can do your birth prep education. Moving past having a really good connected support person and also have a really solid cognitive understanding of what you're moving into, what your body's going to be moving through, there are some things you can do to help prepare your body and to prepare your mind going towards delivery. We're talking about a vaginal delivery. If you're doing a C-section delivery, I still believe you want a doula. I still believe you want to do education, but that might look a little bit different for you. This question was specifically for a person with vaginismus who wanted to have a vaginal delivery. So with any woman or person who's going into labor, we like to do a third trimester kind of birth prep visit in our office. And during this visit, we're going to do check everything, make sure everything is working well and that our patients are comfortable, but we focus in on a couple of things. One is perineal self-massage, learning how to stretch and massage your perineum, which is the tissue just underneath the vagina, between the vagina and the anus, that is going to expand and stretch with the rest of your pelvic floor as the baby's head comes through. And that massage, there are some studies, and there's some fine print on everything as usual, but there are studies that show that this can be helpful for reducing the potential for tears during delivery, tears to the pelvic floor. So we like to teach perineal stretching and perineal massage to all of our soon-to-be moms, and I highly recommend for someone with vaginismus, if that's something that you feel comfortable doing for yourself or going to a PT who can do it for you, I highly recommend. It's going to help mobilize the tissue, and it's also going to get you accustomed to feeling touch and pressure there, which during your vaginal delivery would probably be helpful. If you have a history of vaginismus, that is the premise of the question, it is likely that over time you have developed some trigger points in those muscles, some fascial restrictions in those muscles. And if you can attend pelvic floor physical therapy prior to even getting pregnant, or certainly prior to your delivery, in most cases, in many cases, it is safe for us to work on those muscles, either externally or internally. We can provide trigger point release, we can provide massage, we can provide soft tissue mobilization or scar tissue release to help make sure that those muscles are as elastic and extensible and able to relax as much as possible. Now, if your vaginismus isn't necessarily, if you're not completing your vaginismus treatment, let's say that you still have kind of active vaginismus, maybe you got pregnant using IVF or a home insemination kit or some of the other techniques that people are using, and that internal work is not possible for you, that's okay. No problem. We can work externally. We can teach you to work externally. And if you can't do it at all, that's okay too. But it's on my list of recommendations if it's something that you can engage with and you can tolerate, which would be to see a pelvic PT to help make sure your pelvic floor is elastic and mobile and able to relax. Another thing that we work on in that third trimester visit for all of our new moms, but especially pertinent to a person with vaginismus, is can you push effectively? And that question is two parts actually. Can you generate pressure down? Do you know how to push and push down and out? Surprising, you might be thinking, of course I know how to push down and out, but actually some people think they do and they're not, or they don't necessarily know how to control that pressure. So can you push effectively down and out? And then the second half to that question is, can your pelvic floor stay relaxed while you are pushing down and out? So not just are you generating an effective pressure down, but can the pelvic floor stay soft for that pressure to be effective in helping push out the baby. We can teach you breathing techniques, we can teach you coordination techniques, we can work on different stretch positions to help you access pelvic floor relaxation while you are pushing or bearing down. Also super pertinent to constipation, just a sidebar, side note, but we're talking about pregnancy and delivery right now. So pelvic floor physical therapy or engaging in some of those self-treatments on your own if you can, perineal self-massage and stretching. There is a device. It's pretty intimidating if you see it online, if you're a person with vaginismus, but it's called an Epino. I don't think it's available for purchase in the US. When I was pregnant, I actually got one from a friend who had got one from Europe, and it was on back order and I couldn't get it. Like, they're a little bit hard to get and it is a little bit expensive. But basically what it is, it's a balloon that you insert through the depth of your pelvic floor, and then it's got like a little hand pump and you pump it up and it provides stretch from the inside out. The company claims that learning how to stretch the pelvic floor and then also push the balloon out will help prevent tears and can make you more prepared for labor and delivery. And there are a lot of people that really love this device. As a pelvic floor PT, my perception of what it's good for is a little bit different. I think that what the benefit of having that balloon slowly expanding inside the pelvic floor is that you get accustomed to a sensation of stretch, and you learn how to not reflexively clench when that stretch sensation is happening. So it's almost like an extension of your dilators, but a little bit more functional. The point of the dilators is to desensitize that area to the sensation of penetration so that you don't get a reflexive muscles clamping down, which is what vaginismus is. This device is doing that same thing, but instead of preparing you for penetration, it's actually preparing you to feel pressure, downward pressure at the pelvic floor, pressure and stretch. So does it actually, help the muscles by stretching them? I don't know. I suppose that remains to be seen. But I do think for sure it can help prepare you by being familiar with that sensation of pressure and stretch at the pelvic floor, and you can learn how to not contract into that, but rather actually relax into that, which can help decrease pelvic floor tearing. So that's called the Epino. I'll include a link. That might not be accessible to every woman with vaginismus or a history of vaginismus. You might not be even to the largest dilator. Like we said, maybe you did a home insemination kit, or you did IVF, or some of the other techniques that people use to get pregnant without penetration or with minimal penetration. So you're still working on your dilators. The Epino is not going to be appropriate for you. This is much larger than a dilator. This would be progression past the dilators. So if you're in that first set, you're still working on your dilators, keep working on that. It can be a very similar concept for you. You're getting accustomed to the sensation of stretch and pressure at the pelvic floor and learning how to stay relaxed while you feel that pressure. We talked about, let's do a little recap. It helps me, and then I feel like it's good to recap as we go too. So we're talking about vaginal delivery for a person with vaginismus. We've acknowledged that some of the issues that you might face are similar to what any person might face going into delivery, but it's going to be heightened potentially for someone with vaginismus because there's already anxiety and there's already a restriction to, or a reactivity to stretch or to pressure in that area. We talked about doing really thorough birth education. There's so many different styles. You can find one that fits you and it fits your partner if you have one, and it fits, where you want to deliver and how. Do some research. Go down that Google rabbit hole, because I think you'll find that there are a lot of options and you can pick one that really connects with your personality type. I highly recommend getting a doula. If you can find one that's familiar with vaginismus, great. That might be a little challenging, but in my experience, these doulas are wonderful. They're doing what they do because they care. They want to learn about you, and then they want to coach you through whatever your issue is, and they want to be prepared to help you. So highly recommend birth education and preparation and getting a doula. When it comes to what you can do physically, I'm a physical therapist, so I'm a big proponent of physical therapy, but seeing a PT to help continue your vaginismus treatment, but now maybe focus and shift the goals a little bit away from being able to tolerate penetration or a speculum or whatever it is, and now we're moving into, I want to prepare for delivery. What can we do? We can learn how to push effectively. You can learn how to relax your pelvic floor into that pressure. We can make sure that there's no trigger points or fascial restrictions or scar tissue that could limit the elasticity of the pelvic floor. You can do self-perineal massage and self-stretching at home. And we talked about sort of a ante-up that one, a tool called the EpiNo that some people are using to desensitize to the sensation of strong pressure and stretch and learn how to relax in that moment. I would also like to throw out there that you can get an epidural. An epidural means you're not going to feel anything happening at your pelvic floor. And there are pros and cons to that. And, right now I think on trend is a higher awareness of maybe some of the benefits of having an unmedicated delivery. The con to that is there are some people that really want or need or would benefit from an epidural. And you know what? It's accessible. We have it. It's available to you. So I don't want you to feel pressured or bullied into having the natural delivery that maybe you're seeing popularized. I love that it's popularized. I believe in that. I think that's great. I don't think labor and delivery is a pathology. I think your body can do this. But if you have a pre-existing diagnosis that might impede you and you're working around that, let's just acknowledge that and be real with it. Okay, I have this pre-existing diagnosis. Maybe a vaginal delivery, completely unmedicated, maybe it is the right choice for me, maybe it's not. Let's make space for it to be the right choice or not be the right choice, and know that an epidural is available to you. If you have an epidural, you might not be able to push effectively. So there are pros and cons, and this comes into that birth prep. I do want you to educate yourself. If you want an epidural, what's that going to help with versus what might that create some challenges? And even if you want to get an epidural, I still highly recommend having a doula. The doula can help you get into the best position to labor and deliver with or without the epidural. She can really provide a lot of support to you in either scenario, and I highly recommend it. So I hope this was helpful. I believe that your goal is of primary importance. If your goal with vaginismus is to be able to have penetrative sex, I want that for you, and there's ways to get there. If your goal is to be able to get pregnant, I want that for you, and there's ways to get there, and they don't necessarily have to include penetrative sex unless you want it to. And if your goal is to have a vaginal delivery, I want that for you too. And I don't want you to feel like just because you have vaginismus, it's going to be impossible or insurmountable or too intimidating for you to do. If that's what you want, there are ways to get you there. And again, I'm biased, I'm a pelvic floor PT, but I really recommend finding a great pelvic PT who can help coach you through those things and help you prepare in your way for whatever your individual goal is. I believe that first you have to know yourself, meaning, okay, for example, I'm a person with vaginismus. This is my issue. You then have to accept yourself and say, okay, given that that is my situation, what is the best thing for me? Let's not fight reality. Let's work with what is and make it as good as possible for whatever your personal goal is. I honestly believe that that should be and can be accessible to you with the right education and planning, and of course, access to the right resources, which isn't always possible. Please consider me a resource. I love receiving questions because it lets me know what you're thinking. It lets me know what you're wondering. So please feel free to ask any questions either on the live videos that I do every Wednesday at 12:30 Eastern Time, or I post the replays on Facebook as well as YouTube. You can always chat with me in those places and ask questions there. And I would love, of course, to engage with you live. That would be great too. If you found this video helpful, I would love to hear your comments. I would love to hear your history or what you've heard from other people. And I would love for you to like the video. If you'd like to see more of my content, if you would subscribe, that way it pops up for you. I'm on YouTube, I'm on Facebook and Instagram, and I would love to connect with you in those places. I do have a newsletter for Vaginismus if that's of interest to you, and some free resources that you can get through subscribing to that. So please like if you liked, please subscribe if you want more, and I look forward to seeing you next week.